Thank you for the opportunity to address this distinguished group for the second time. I was here this spring. So I'm going to do my first slides fairly quickly just to get us back on track where we were in the spring session. So the objectives, the first two were dealt with actually in the spring about who the Interprofessional Professionalism Collaborative is, or IPC, and then the construct, which I'm going to remind you because the instrument is based on that. But my focus will be on the last three objectives, where we are in the development status of the Interprofessional Professionalism Assessment, potential benefits of this assessment and how it could be used in the future, and then where can you learn more about it. So that is the group of members of the IPC. I'm going to at least let you know there are three here. My colleagues are here today with me, Dr. Catherine Groves from Psychology, Dr. Loretta Nunes, who's from American Speech Language Hearing Association and represents both speech and audiology, and Dr. Neil Harbison, who's from the American Occupational Therapy Association. And none of this work would happen without 14 colleagues who are part of this process. So here's our three purposes. The first one we've done, we have a definition, you'll see that shortly. The second is where we are now. And the third is actually happening in a parallel process. So as the instrument is being tested in a pilot, we're also beginning the educational component of helping people understand what it is, how to use it, and how to begin to infuse that in both academic and clinical settings. The definition is here before you in front, but I'm going to ask you to look at the actual description of aspiring to altruism, excellence, caring, ethics, respect, communication, and accountability. And within the construct, those are the items that we're actually going to be measuring. There are 6. We actually have altruism and caring together because of the number of variables we could define with that. We had to put them together. So that's the construct that's measured by the IPA. And it is a part of our vision. It's a definition of interprofessional, and we needed to come up with observable, measurable behaviors in order to translate what is a definition into real life and practice, the application side. So here's where we are in the process. We began with a literature review, which everybody does, the definition of the construct. In 2008 and 2009, we actually did national presentations with an online survey of all of our professions that were part of the group. In addition to 3 international, we were in Melbourne, we were in South Africa, and we also did Amsterdam. And then we began with a content expert review of a tool that people believed was worthwhile, and a few of those individuals are actually in the room who helped us with the content expert. We took that and they helped us to reframe the instrument in some places and to reduce the number of behaviors in the items. In 2011 and 2012, we actually conducted 2 rounds of cognitive interviews with typical preceptors who would actually use the tool, not academicians, but the people in the clinical practice who will be making the assessments. And they gave us feedback about which items were the same, which were redundant, which were unclear, and helped us to reduce the tool to what is now 26 items, observable behavioral tool. So here we are, 2013-14, and we are now having, the IPA is actually underway and the pilot has launched in September. And we had to go through an approval process, an extensive IRB approval process at the University of Mississippi. Our PI is John Bentley, who's a biostatistician helping us with this process, whom we could not do without his assistance. And then we hope in 2015 to be able to submit several publications and make this instrument widely available. Hopefully it meets those initial criteria, the 7 of them, but certainly validity and reliability. So the pilot instrument, let me give you a little bit without giving you the instrument. It has 6 categories. Those are the categories that are there that are congruent with our construct. It's a 26-item-based instrument of observable behaviors. There's at least 4 behaviors under each of those particular categories to ensure it's a solid tool. We're using a 5-point Likert scale from strongly disagree with a neutral to strongly agree. And then there's an N/O, which means no opportunity to observe in this environment. There are some of the behaviors that we have suspicion may or may not be existent in our current practice. So they are descriptive of what IPP ought to look like, but they in fact may not be consistently demonstrated by professionals, let alone our learners. And then it has comments at the end of each category and 2 global summary questions that ask about the overall strengths and areas for improvement in interprofessional professionalism. Our study period is September 2013 to 2014. It's a year-long study. We're using a cross-sectional design with online survey research methods. We do have IRB approval, and we have preceptor student dyads who are going to be completing the instrument. So we're starting it with learners first. Where we're at, I have to tell you, in doing the methodology, our first methodology, when we tested with 3 institutions, fell flat on its face. We had to go back to the drawing board for 6 months to redesign the methodology because it would not have gotten through their IRB. So 49 academic institutions across the U.S., and all of them have to manage IRB approval. That's the first hurdle. There are 13 health professions that are potentially involved in the study. But what's happening is they have to have institutions that have IPE, and they have to be sending students to preceptors that practice in collaborative practice. So we're testing a tool in the methodology that we want it to be. So some of the institutions who wanted to participate are not involved in IPE or do not have their students doing collaborative practice. We've elected to take students completing their final practice experiences prior to earning their professional degree, and that language is very specific because the way we all call that in our terminology is very different. So we've described what that is. The preceptor will be asked to watch the student throughout the experience, but assess them at the end of the experience. And after they log in, the student receives an email to now conduct their self-assessment of their behavior using the same behaviors. We're hoping to collect 750 to 1,000 preceptor student dyads across these 13 professions, and we're using Qualtrics to do this, and Qualtrics has been wonderful. They've been redesigning some of their software to make it easier for us to do this particular study. We've asked for specific things in order to make this work. One of the things you ought to know is the university gets an email that they forward to the preceptors. That's all they do in this study. And it still requires IRB across 49. They forward an email. We're going to randomly split the sample in subgroups to allow for some initial cross-validation analysis. We're doing exploratory and confirmatory factor analysis to see, in fact, if 6 categories are the 6 categories and how our behaviors align with that. We'll be doing some metric calculations for convergent and discriminant validity and construct reliability. And then we're going to look at the invariance between the preceptors and the students and how they rate those scores for some fun. So the benefits of this instrument, it does measure, we hope, an IPP construct that is interprofessional, being tested interprofessionally, bridging academic and clinical practice and tested with learners in practice. It's going to be piloted with different health professions. We'll find out if it works for all professions or not. The academic institutions, again, with IPE and with collaborative practice. It does begin to connect higher education and healthcare as a tool. It can be used to connect for the triple aim, IPP, and it may impact how students and practitioners are educated and assessed with respect to interprofessional professionalism. They do complete a demographic survey, and one of the questions we ask the preceptors is, how well do you demonstrate these IPP behaviors, in one of the questions. So we're curious to see what we get back on that. We hope to, in the future, disseminate our research findings in 2015. We're developing the toolkit, and that toolkit will have the instrument. It'll give information about what can you do in education and practice, how can you use it, and what's its relevance for both communities. We hope to develop next steps on the pilot, depending on what those outcomes are, other studies that can be done by all of you in the room using the tool. And then the next leap for us might be, how could patients use this tool with some slight language change to assess their team? So the tool right now can be used for learners, peers, colleagues, subordinates, but we haven't done the patient side. We have to change the language. And finally, if you want to learn more, we're currently updating our website. We have a website team in our group, so we're in the process of getting that all up to date. And those are our 2 articles currently that we have published, primarily on the construct. And we hope to be able to come back with you with a valid and reliable, solid tool that meets all 7 of those performance dimensions that were talked about this morning. Thank you.